Dr. Elliott Cleveland, physical therapist and founder of Marching Health here, and we want to help you avoid injury meltdown this drum corps season. What do we mean by that? If you've ever done drum corps before, you have probably seen a member, unfortunately, sustain an injury that just continues to linger and get worse and worse throughout their drum corps season. That is because of the unique demands in drum corps where you really don't get days off. You have to continuously be on your feet performing morning, afternoon, and night. We want to make sure that you understand what pain is okay and what pain is not. So it's not no pain, no gain, as in the old push through it mantra. It's no pain, no gain with a different spelling, K-N-O-W. Know, to know and understand your pain and understand what pain you can push through and what pain you should not push through. Here are some descriptors or examples of pain that's typically more traumatic or acute injury related. You'll describe it as sharp. You'll describe it as an intense burn or a feeling like a hard pull or hard tear. That's typically indicating something that you may need some time off for, and you may need to take some time off for during your season to let recover and rehab it at the same time. Do some rehabilitation exercises or see a healthcare professional to get you back to speed faster. If you're having some general soreness or achiness that might actually be more intense soreness than you've ever felt before, or might be in places you have never experienced because drum corps just finds ways of wakening up muscles that you didn't even know you had. Excuse me, my rule, as long as that pain is not pushing you over the edge and getting worse, it's okay to rehearse through. So if there's a scale and 10 is I am coming off of social media to your drum corps site and having to carry you to the emergency room because it is such a bad pain, dragging you off the field, that's a 10 out of 10 pain. And 0 means I have no pain at all. I want the members staying below a 5, so staying on this side of that threshold. If the pain is getting 5 and worse, that's typically a pain that we need to sit out for. So if you're at like a 3 or 4, maybe let's give an example of having some calf pain or some knee pain, and it stays a 3 or 4 out of 10, no matter how much you're rehearsing, that's probably okay to continue rehearsing through. Now take that same pain and it starts to get really sharp and it becomes more like a 6 or a 7 as you continue to push through that. That is not something we want you to do because that's indicating that you're further causing an inflammatory and painful response, which is going to cascade the injury and slow your recovery process. So once it has become more of a stable pain, that's actually often okay to push through. And there are even some tendonitis injuries where it's okay for you to feel that pain while doing your rehab exercises. But that's more up to the specific case, and you should talk to your doctor or physical therapist about that. But the main thing we want you to know is no pain. Know what it means, know what it should feel like and what it shouldn't feel like so that you can have gains during your drum corps season and continue to push through at a maximal level. Thank you.